And on Friday morning, since this whole crazy coronavirus thing started, we have had the good fortune of having Dr. Kavanagh, who is the founder and president of a nationwide organization called Healthwatch USA, to be our regular expert. And he is an expert on that. He's also a retired physician from Somerset, Kentucky. And Dr. Kavanagh, first tell us what Healthwatch USA is about, and is it something anybody can join?
Well, yes, we have very low criteria for joining. We take absolutely everyone. There is no dues. Just send us an email. We're a very informal organization. We have no funding from the outside sources. If you do tend to join, you may get a note now and then to please contribute to this project or that. But we have individuals, nurses, and physicians from all over the nation now that have joined our group, and even more so during this virus epidemic. Probably one of the bigger organizations which we've been working quite closely with is the Massachusetts Nurses Association, which, as you know, is in one of the major hotspots. So we have a lot of firsthand knowledge that we're getting from them. And believe me, this is something we should not mitigate. We need to pay attention to the governor and practice good social distancing.
Okay, well, now if you have a question or a comment along the way here, you can either call us or text us. It's the same number, 253-5959. That is our phone line, and it is also our auto text service text line if you would like to send us a text. And this came up last hour, Dr. Kavanagh, and we said at the time, let's ask the good doctor when we get him on. And hang on a second, I got too many. I'm like the governor, I have too many papers in front of me here. Here we go. Could smoking prevent coronavirus? A hospital in Paris found only 5% of its coronavirus patients were smokers. So now researchers in France starting to test to determine if nicotine helps block the virus from entering cells.
I wouldn't jump on that much. There's been some data that show that smoking is a risk factor for poorer outcomes with the coronavirus. So that is something I wouldn't jump on. The French actually had an initial very bad study that showed hydroxychloroquine maybe have some benefits, and that's been pretty much discredited since that time, along with a whole flurry of studies showing that they can't see an effect.
Well, and I've not been to France, but I know that the French people really like to smoke. And so, I would think that they would have had a whole lot of people in with corona, that were smokers. I just was surprised, that it was only 5% of the patients.
Well, that I can't tell you. I mean, it could be just 5% of the patients sampled, 5% of the patients in that area. Who knows? Smoking, even in Kentucky, varies largely between county to county. So you really have to look at the study. But I wouldn't give much credence in that. I have seen studies that show that smoking is a risk factor for poor outcomes.
All right, now you told me in a text or an email earlier in the week about this is going to be, looks like a bad news week, and we've already talked about this. Let's try to talk about having people call in on ways they're coping with being home. I think that's a great idea. And you also want to know if anybody spent $20 to rent a 2-day new release movie. Have you?
Well, actually, under great pressure from my granddaughter, I have, yes, once.
Oh, okay.
Yeah, it was Trolls movie. What can I tell you? But it is, and I wonder if that's not going to be the death of the theaters. If this type of distribution works well, that may be the way we're going in the future. People have large screens. A lot of people do. I kind of wonder that. Movie theaters were on the verge of not doing too well to begin with. As you know, many have closed in Lexington. Prices have gone up and the seats have spaced out fewer, and lounge seats, they've changed their method of marketing. And I really think that may be a way things are changing. And I'm not sure how many people are doing that, but if a lot do it, it doesn't look good for movie theaters, in my opinion. They've cut out the middleman.
All right, here's Leslie. Good morning, Leslie.
Good morning. Dr. Kavanagh, I am getting conflicting reports from friends about whether we should be tested here in Kentucky. Is there an abundance of testing so that everyone should be tested?
Well, it depends on where you're looking at. You can go to an area that is testing or just kind of wait for testing to appear. But there are some caveats you need to know about testing. There are two types of tests. One is for the antibody, the other is for the virus. Now, if you get the viral test, it's going to be most accurate around the time you develop symptoms or while you have symptoms. If you get it too early from the time of exposure, it could be negative, and then you could go on ahead and develop symptoms and start shedding the virus after you've had the test taken. Also, there is a false negative with that because the test requires a swab, a bunch of different steps, and if they're not followed exactly correctly, you may have a negative test when really you were positive. So again, if you have a negative test and you're developing symptoms, don't really rule out COVID-19. You may want to get a second test. The other fact is on the antibody test, that is really in the early stages of development and deployment. So again, you have to be careful with that. It takes a while to develop antibodies, and just because you have antibodies does not mean that you're going to be immune from getting another viral infection, although hopefully it wouldn't be as great. Now, one of the other caveats with the antibody test is that these tests have just come out, and again, you may have false positives. In other words, you may have a test that says you have antibodies when the antibodies could be to a run-of-the-mill coronavirus instead of to the COVID-19 virus. Now, whether or not those confer any sort of immunity, who knows? But for example, a deputy commissioner from the Division of Disease Control out of New York City sent out a memo, and this went to the Massachusetts Nurses Association, also obtained this. It was one of the caveats on the test is that cross-reactivity of antibody to other common coronavirus proteins may also occur, so a positive serology may either reflect infection with COVID-19 or SARS-CoV-2 virus or past infection with other common human coronaviruses. So that's pretty technical, but it does mean that you can get antibodies, but the test, needs to be taken into account of whether or not you had previous symptoms and not go out and say, oh, I don't need to social distance anymore, because you do have false positives. So I know that's a long answer.
Go back to what you said at the beginning. You said there are two tests. One is antibodies, and the other is just for the virus itself?
Yes. There's two types of tests. This test for the virus is when you become infected, and early on it will be positive, and then hopefully the viral proteins and shedding the virus goes away. The antibody test is after your body has an immune response, and that may take a while for you to pick it up, so that won't work early on, especially after you've just initially been exposed to the virus and haven't developed antibodies yet. But it may be positive for many, many months afterwards, meaning that you've been exposed to a coronavirus.
Does that help, Leslie?
Well, yes, except that I'm confused. My friends think that Governor Beshear has asked that everyone, symptomatic or otherwise, be tested if it's available, and it is here in Lexington.
Correct. They want people who are asymptomatic, who don't have symptoms, to be tested so they can get an idea of how prevalent the virus is in the population, how many times people maybe have had the infection and they don't know it, how many asymptomatic spreaders there are. And so they want a sample of people coming in to be tested. But I don't think that everybody can be tested. I mean, they don't have 4 million tests. But they do have enough tests that if you're worried about it, go in and get tested, because it will give you some guidance.
Okay, but if I'm not worried about it, the governor's not asking me to go anyway.
I
don't believe so, because I don't think they have 4 million tests.
Thanks, Leslie. Good question. Mike, good morning, Mike.
Yes, sir. I was watching the previous caller. I was thinking the governor said everybody go get a test, but I may have been misunderstood him on that too. But it sounded like that he wanted everyone to have a test.
Well, I would think it's everybody can get a test that wants one. but I don't believe they have 4 million tests, and they don't have enough testing centers for 4 million people all at once to get a test. Now, ideally, everyone should have a test, but I don't think they could do it, for example, today. The capacity's just not there. But I do think that's a long-term goal.
I can understand that.
Yeah, but I don't think it's a goal today. So that's the difference. I do think everybody needs to get a test at some point, but they don't have 4 million tests, and they don't have the testing facility. I mean, we've got one that just opened up in Somerset. Well, we have 60,000 people in Somerset. They can't all get a test today. It's going to take some time.
Well, and Dr.
So
Kavanagh,
that little test, the test, the swab that they do, does that test you if you're not having any symptoms, and if you had it a month ago, will that take that into account?
No, the antibody test is a blood test. So the swab won't give you the answer if it's a month ago. See, that's the one I would want, is the one that tests for the month ago. But that's not really available yet.
That's what I was thinking.
And that test, as I said, that I think is going to improve as they get better and better antigens that are more specific for the virus. So I wouldn't be too much in a hurry of getting a test unless for some reason you really need to get a test. I mean, if you're a healthcare worker that wants to know if they can go in and see a COVID-19 patient, if they've had antibodies or not, that's a really good, that's a good reason to get a test. For me, I'm just staying at home, and I'm going to let these tests get a little bit better. I'm not that worried about it because I'm doing strict isolation.
I appreciate your call, sir. We're going to take our break. Dr. Kevin Kavanagh is our guest. And we've got some pretty interesting questions here on our text line. Kevin, when you go outside the house for a walk and return to the house, do you need to clean your shoes, especially the soles, with disinfectant wipes? And how do you go about cleaning your plastic packaging on our meat products when we bring it into the home from the grocery?
Well, I personally use soap and water on the meat packaging. We usually do that anyways. And as I said before, there's some evidence that soap may actually kill the virus, which is kind of like a little grease ball. It has a lipid protein capsule, and it will wash the virus off. That's just good food handling. Likewise, cooking the meat, don't putting it on the counter. If you do, wash the counter. Because foodborne illnesses are not just with coronavirus. As you well know, there's been E. coli outbreaks, salmonella, and this is just common good sense in food handling. Fruits and vegetables also want to wash off, and there you're also worried about pesticides and fungicides. So this is something you want to start doing. You should have been doing it all along. This is nothing that's new. As far as shoes go, I don't worry too much about that. I don't track my shoes into the house, however. I take them off in front of the door and leave them on the side. One of the things that we've talked about before that I think has been confirmed by this week's research and presidential briefings is that sunlight does tend to zap the virus. So if you're worried about shoes and worried about the soles, I just leave them outside and turn them upside down. But in general, I don't think you need to go around and clean off shoes, but I wouldn't be tracking and walking with your shoes through your house. And that's, again, something that we've done forever. I mean, we have never walked through our house with shoes. We take them off and walk in our stocking feet.
Here's another text. I heard the hydrochloroquine is working unless you have been intubated or have other issues that clash with the drug. Are you saying that it's not working? Because that's not what I've been hearing.
Definitely not working. That's what I am hearing. There's been an initial French study which was discredited. Then there was another French study, small, which didn't find it to work. There was a Chinese study which showed no effect, and that was a small study, and that was after the initial narrative from China, according to President Trump, that this was a great drug that he had heard. And then there was a Brazilian study using high doses of hydrochloroquine that did not work. There was a VA study from the United States which did not work. And that study, although it was retrospective, indicated that there was a higher death rate in those that took hydrochloroquine. And finally, there's the New York data, which was submitted last Sunday or Monday to the FDA, which has not been officially released, but yesterday Governor Cuomo said that when he was briefed on it, it was his understanding that it did not work. So I can't find anything that shows that it works other than anecdotal reports. In other words, someone saying, oh, we took it, we got better. Well, they might have gotten better anyways. And there is some evidence and concern that it may actually make things worse. What it is doing is taking the drug off the market, and people who need it, such as those that have lupus or rheumatoid arthritis now, can't find it. So it is causing some harm with those patients anyways. I do think we need to quit taking this unless it's within a controlled study. And personally, I wouldn't consent to be in a controlled study. I think there's enough evidence out there to really put up red flags.
Kathy says, isn't there concern that the worried well are wasting tests?
Well, no, because we really do need to know how much this virus has penetrated into our community. Remember, when you say well, what do you mean by that? Do you mean having symptoms? Or do you mean carrying and spreading the virus? This virus spreads through talking. It spreads by fecal routes. It spreads by sneezing and coughing. It's a highly infectious virus, and some people don't have symptoms. So you need to get a handle on those asymptomatic carriers. As many as 50% of the people get this virus from people who don't know they have the infection.
We're out of time. Dr. Kevin Kavanagh, thanks. We'll talk to you on Monday. Thank you, Holly.
Thank you.